Do you get severe anxiety due to a certain event in your life in the form of flashbacks and or nightmares? Does that lead to you having uncontrollable thoughts of that certain event, which leads to severe amount of distress? If you've answered yes to those questions, then it is highly probable that you are going through something known as post-traumatic stress disorder or PTSD. So stick around for today's video where we will take an in-depth look at what PTSD is and what you can do about it. PTSD is a mental health disorder that gets developed due to the individual seeing a traumatic event or experiencing a traumatic event. Some of these traumatic events include combats, a car accident, an assault of any kind, or even the death of a loved one. Now, in normal circumstances, an individual's own protective mechanisms known as the fight or flight response come into effect to protect them. But in the case of PTSD, these protective mechanisms take on a whole new level because of the amount of trauma this person has experienced. PTSD symptoms can start either within a month of the traumatic event occurring, or they can be seen to happen even years after the traumatic event. Now, they are divided into 4 categories such as intrusive memories, avoidance behaviors, changes in thinking and mood, and changes in physical and emotional reactions. With intrusive memories, the individual will have recurrent and unwanted thoughts of that traumatic event. It will be so severe in nature that the individual may perceive it as if it is happening all over again. These intrusive memories can happen in the form of nightmares or just sudden flashbacks. Avoidance behaviors include just not talking about the traumatic event or pushing it away from your mind completely. The individual will avoid certain situations, people, event to avoid having those flashbacks of that traumatic event again. Negative changes in thinking and mood include feeling really down and having a negative perception about themselves and of the world. They start to feel hopeless about their future. They have memory lapses regarding the traumatic event. They have difficulty maintaining relationships and getting connected with family and friends again. They become emotionally numb, which means they feel as if they cannot feel the positive emotions in their life again. They stop enjoying activities they once enjoyed, which means it tends to lead them into other mental health disorders such as depression. Changes in physical and emotional reactions include getting easily startled or frightened, always being on guard for danger, self-destructive behaviors such as alcohol abuse and drug abuse. They have trouble concentrating and trouble sleeping. You will see the individual go through aggressive behaviors, angry outbursts, and just being irritable due to the fact that they go through overwhelming guilt and shame in their life. Doctors aren't sure as to why the symptoms of PTSD develop, but like any and most mental health disorders, there are some common causes, and these include the amount and severity of the trauma the individual went through, inherited through the family if there is a family member that lives with anxiety problems, and having a temperament where the individual is more prone to certain events that happen in their life, especially the negative ones. People of all ages can develop PTSD. Now, the risk factors include experiencing intense and long-lasting trauma, having childhood trauma in the form of childhood abuse, individuals who have jobs where they are exposed to traumatic experiences, such as military personnel and first responders, substance abuses such as alcohol, drugs, and drinking, having a lack of support from family and friends, individuals with other mental health disorders such as anxiety and or depression can lead to an individual developing PTSD. If you're finding this video informative so far, then do give me a thumbs up and subscribe to my channel. PTSD can disrupt an individual's life in all realms, such as professional, social, and personal relationships. It can also hinder everyday activities. Some of the common complications of PTSD include mood disorders, such as the development of other anxiety disorders and depression, substance abuse disorders, such as dependence on alcohol and drugs, suicidal thoughts because they feel hopeless and helpless about their future, eating disorders. As stated by the National Association of Eating Disorders, eating allows these victims to subdue whatever they are feeling and relieves them of the pain that the event has caused in their life. The diagnosis of PTSD is given by a trained mental health professional or a psychiatrist. In order to get a diagnosis of PTSD, the individual should have experienced an event which caused them to feel as if there was possible death, violence, or serious injury that could have happened to them, having witnessed this event as form of a second person, or going through traumatic events constantly due to their jobs, such as those who work in militaries or are working as first responders. Now, to get a formal diagnosis of PTSD, a psychological evaluation will be done where the amount of intrusive memories is going to be gauged. How have they started affecting the individual? What are the emotional reactions to those thoughts? What are the behavioral patterns that the individual has established in order to protect themselves? To get the diagnosis of PTSD, the trained professional will use the criteria given by the Diagnostic and Statistical Manual published by the American Psychiatric Association. The primary form of treatment of PTSD is psychotherapy, but medications can also be prescribed. The treatment involves getting the individual to regain the control of their life by understanding the triggers and to start working on the symptoms as they arise. It allows them to remove the hopelessness that was created due to the symptoms of PTSD. Several types of talk therapy can be used to treat PTSD, and these include cognitive behavior therapy, where the individual will understand how their thoughts and emotions and behaviors are all interconnected with each other and have created a negative loop of thinking. They will learn to unravel that thinking, focus on the emotions and focus on the thoughts to slowly regain the control in their lives by controlling the thoughts that come as being intrusive memories. Exposure therapy, which is relevant when the individual has flashbacks and nightmares of that traumatic event. It is a form of graded exposure where the therapist will take you down the memory lane slowly and allow you to go through those emotions once again in a safe and secure environment. Several types of medications can be prescribed for the treatment of PTSD, and these include antidepressants, which are known as selective serotonin reuptake inhibitors and are used to treat the symptoms of depression, anxiety. They also help with sleep problems and help improve concentrations. Additional treatment options for PTSD include follow your treatment plan. Follow the treatment plan that your trained mental health professional has outlined for you. It is going to be difficult because you have to face those traumatic memories again, but in the end, it will help you overcome that fear, anxiety, and distress. Stay connected with your family and friends. Be in touch with them. Let them know what you're going through. Stay in a support group or find a support group if your mental health professional advised it for you. Because going at it alone makes you feel as if the whole future looks bleak and hopeless. But going through it with others allows you to get that necessary support for your own individual growth. Now, my hope with this video was that you understood how an individual with PTSD lives with such severity of symptoms and the distress that they go through. If you found this video beneficial, then do give me a thumbs up and subscribe to my channel. Next week, I will talk about selective mutism, which is a form of anxiety disorder. I look forward to seeing you here next week. Have yourself a wonderful weekend and a great day ahead. Bye-bye.